what are some of the priorities when it comes to cancer care in Canada?
Well, first of all, cancer affects us all. 2 in 5 of us are going to have a personal diagnosis of cancer. 1 in 4 of us will die of cancer. So if it doesn't affect us personally, it affects someone that we care about. My organization, the Canadian Partnership Against Cancer, is designed to work with jurisdictions and other partners to advance pan-Canadian priorities in cancer. So healthcare is a provincial jurisdiction. We work with the provinces, the cancer agencies, the cancer societies, Indigenous organizations. So as some examples of the priorities we're currently working on, one would be lung cancer screening. So it's a new innovation, and the goal is to try to accelerate its availability and adoption throughout the country. And as opposed to having each province try to figure out how to do that on its own, we work to convene experts to figure out what should be the eligibility criteria, what should be the procedures after you have a positive screen if you find an abnormality on a scan. One other example I can talk about is also trying to work with the provinces to identify some of the leading best practices from leading jurisdictions like Alberta. And an example there is paramedics providing palliative care. So this is a great advance. Prior to this work that started in Alberta, even if you were a patient with a terminal cancer who wanted to be at home and to die at home, if you perhaps had a symptomatic crisis and called 911, paramedics by regulation had to come and just stabilize you and then bring you to hospital. And so what Alberta started doing, and what we have been helping other provinces do as well with coaching from Alberta, is first of all to train paramedics in palliative care and to change the regulations where needed so that they could keep people in their homes by managing, whether it's pain or shortness of breath. And what we found is that over half the time they're able to keep them in their homes, that this sort of approach saves the system money, frees up resources, emergency rooms, paramedics, et cetera, for other things.
What is it like to see the innovation that people have and the ideas that people have to make a difference?
It's really, really gratifying, and there are a lot of advances, a lot of good things happening in the cancer realm. So despite those statistics that I started off with, cancer incidence is actually decreasing. And that's because we know more about prevention, better diet, better exercise, not smoking and drinking as much, vaccination, such as with the HPV. So we're seeing a decrease in the incidence of cancer.
I like that level of optimism. Dr. Earle, thank you so much for taking the time for us today. I really appreciate it.
My pleasure.